Hello, and welcome to Have Your Say. I'm Anne Minicozzi, president of the Community Breakfast Collaborative, here with our co-host Diana Robertson, president of the NAACP Mainline Branch. And our guest today is Candace Robertson-James from LaSalle University. So thank you very much for being here.
Thank you so much for having me. I'm excited to be here with you today.
So, Candace, why don't we're going to let you tell a little bit about yourself, your title, where you work, and start there at LaSalle.
Sure. I'm the director of the Master of Public Health program at LaSalle. Our department is the Department of Urban Public Health and Nutrition. And we have a public health program that services both undergraduate and graduate students.
Okay. And so in regard to the work you do there and the promotion of, since it's a university, of students being a part of your program, how do you encourage students to do that?
Well, there's many, many ways. I think, I always joke when I was an undergraduate student, there was no kind of undergraduate public health programs, but now there are. And so I think the first thing is helping people to understand what public health is. Even though more people have heard the term and are familiar, there's still a lot of people who really have no idea, and most high school students have no idea what the field of public health is all about. And so first is really trying to educate people that, what public health is and what types of careers one could have in public health. I always say that the greatest thing about public health is that you could almost do anything. And then the worst thing is that you could almost do anything. And so sometimes people are like, well, what career? I know what a nurse is, I know what a doctor is, I know what a lawyer is, I know what a social worker is, but what is a public health practitioner, and you could work in environmental health, you could work in health policy, you could be working on gun violence, you could be working on healthcare administration, you could be, working in a nonprofit organization, in advocacy and program development and evaluation. And so there's just so many different types of jobs that one could have, but it's very exciting because I think the field of public health has continued to expand, and there's so many different skill sets that one can integrate into promoting the health and well-being of our population. So whether it's at the undergraduate or the graduate level, there's lots of ways that people can be involved and really integrate their passions and their skills to really promote health.
Can I ask, when you were studying as an undergraduate, since it wasn't a public health major, what were like the components that you studied to get to that point, so then you could do the master's and then your studies after that?
Sure. So I graduated with a degree in biology.
That makes sense.
Yes. And so, back then it was, medicine or nursing. And I knew I was interested in kind of the health sciences. And so I pursued biology with the thought of maybe going to medical school, and then just still wasn't sure. I knew I liked health and well-being, and really accidentally through a program that I was involved with, really became exposed to the field of public health through some research activities and HIV work to really say, wow, this is it. This is what I've been looking for. But we do accept, even at the master's level, we do, to that point, accept students who have a variety of different backgrounds. And so a lot of our students come from communications degrees or business degrees, and then obviously we have a growing number who have public health degrees at the bachelor's level, but we have a variety of different applicants and students who kind of come to us from all sorts of backgrounds.
So the public health, it seems to me, and if you could just elaborate more,
Sure.
that there's a communications component to a specific population that had, like an HIV population.
Sure.
There's the communications part, but then also sort of the sociological, because you're working with a particular group and trying to help that group with what those needs are.
Absolutely. A lot of public health is communicating, right? It's trying to figure out how to communicate health messages to the public, how to communicate risk to the public, how do we talk about these issues. And you're right, absolutely. How do we work with populations? How do we understand their needs and their desires? How do we understand and make sense of their risks? And how do we create interventions that are effective and based on evidence? And how do we understand how policies and programs and our environment influences our ability to create interventions and work with people in an effective manner? But a lot of it is from every day. We always joke that, in marketing, traditional business marketing, there's millions of dollars often for the large companies to kind of get their message out to you.
Yeah.
And there's not in public health, there's not millions and billions of dollars to sell health, as well as health is not glamorous sometimes. And so how do we make those messages attractive? How do we get those messages out to a large variety of diverse individuals? And what is salient and what might land for one group might completely miss the mark for another group. And so how do we understand those nuances as well?
And then that probably takes a lot of time, because if you have a message for one constituency and then you're going to, as you're saying,
Absolutely.
communicate it to another constituency, you have to rework the whole thing. So that
Absolutely.
takes a lot of time.
Absolutely.
Yeah.
Absolutely.
And so, having the conversation, Anne and I've been with others have been talking about the fact that, I guess, for lack of better words, is to say, we talk about the ills of society, so to speak, and I know you constantly make a reference that you believe that everything else really comes out of a public, or should come out of a public health perspective, and we know that does not happen. And so when we start looking at the ills of society, number one, being able to describe what they are, but then how do we begin to have an effective conversation or dialogue or action as to how we begin to really address the problems? So, having said all that, what would you term as the basic ills of society? And from a public health perspective, how do you believe we should begin the conversation and the action?
Well, I think, one of the biggest things is that there are so many public health issues. We're just looking at the American Public Health Association is in the process of kind of refining their 2020 policy statements, and released recently sort of what the proposals are. And they're really all across the board. And when we think about so many public health issues that our country is facing, from immigration issues, from gun violence, from environmental health issues, clean water, believe it or not, still an issue in this country. And so we have lead issues that are emerging and have continued to be problematic for our country, to chronic diseases and heart disease and cancers and suicide that is now a leading cause of death in this country. And so, there are just so many issues that we could kind of, spend lots of energy and time on focusing on all of them. But I think many issues, not all, but many issues really in public health, we like to say, kind of boil down to what we think of the foundation of social determinants of health, right? And so if we would kind of, I guess, in your language term, those ills would kind of be that foundation of inequities in the social determinants of health. And I think in public health, we would like people to recognize that as really a lot of the core kind of foundation of a lot of the things that we're dealing with. And so a lot of things do come back to, economic inequalities. A lot of things do come back to housing inequalities, to educational inequalities, to labor inequalities. And so, so many things are kind of remnants of the basic inequalities that we have in our country. And so to that end, some of the solutions really are, we're still working towards promoting equity. And even in the obviously, we're in a new decade now with Healthy People 2020, and so we are anticipating the release of the Healthy People 2030 initiative, the objectives that will be released at the end of March. And so We believe from what has been released so far that the goals will still include things like, dealing with health disparities and health equity, a focus on those things, promoting prevention is still going to be a focus on. I believe they have also added a goal that is about multi-sector collaboration, which again, because of the multifaceted nature of these issues, we all really do have to work together.
Yeah.
Education is a part of public health, labor, employment, housing, like we all need to be working together. Health and the promotion of health is just not the responsibility of one sector. And so I think that will be an important a goal, and I'm curious to see how they make sense of that as far as the indicators and the objectives that will be tied to that. But I think that really the promotion of equity is so important, and it's obviously important to the work that both of you do, but so important to the promotion of our health and well-being of our infrastructure. And so I think, in public health, we are focused on that ecological model, really thinking about not just the individual and how I can eat healthy and how I can, eat my veggies, but the school system and the community and the family and the society, the community in which I'm engaged in is going to have a huge role to play in my health and well-being. And unfortunately, we don't well recognize that our policies many times are what created the inequities that we experience. And so we're going to need policies and interventions and deliberate evidence-based strategies to really undo the inequities that we observe now. They're not accidental.
So so having said all of that, that's really good. So I'm thinking from the academia world. So in your programs then at schools, are there specific ways that the students are being taught in these different categories to help understand that, so that as they're graduating and moving into the different sectors, that they will be able to provide that lens of how you begin to start to really address the issues? Is that being done
Absolutely.
as far as courses and internships and your programs?
Absolutely. So in our program, one of the focal point is health disparities in urban communities, and really trying to help students think about that lens and help them to understand evidence-based approaches to promote equity, and have them, play around with that in different courses to really look through the lens, that lens as they pursue these issues, to not just think about the individual level approach, which is an important approach. It's needed, is what we call like the downstream approaches. We need to kind of focus on the individual in front of us and what we can do for that individual, but we will always be there if we never go upstream and understand, what are some of the things that are creating the disparities that we see, and the issues and the problems and the stressors that individuals are experiencing. And so we try to, have students understand the importance of all the different kind of layers that influence population health. And then, yes, through their practica experiences and capstone experiences, they really are able to delve more deeply into specific topic areas and understand how agencies and organizations really approach these areas, and be able to contribute to the field and kind of see themselves as leaders in public health, and kind of reimagine, like, where do we need to go in the next decade or the next 2 decades to really begin to undo some of these things. So hopefully in another couple of decades, we're not still talking about the same things that we're talking about now, and as quite honestly that we've been talking about for a long time.
And what are examples of capstone projects that some of your students have completed, just to see what they decided to pursue in their studies? Because you give them a wide range of things as they're going through the masters.
Absolutely.
So just some examples of what they decided to focus on that was compelling.
Absolutely. So you're right. Our students do have a variety of different interests and have lots of different types of capstone projects. We have students who have completed projects around lead in the water. We have students who have completed projects around breast cancer awareness, breastfeeding, initiatives in inequities, I should say, in specific population groups, maternal mortality, diabetes, and looking at disparities around diabetes and non-compliance or people who are not progressing in their regimen. We have students really looking at HIV and sexually transmitted diseases. We actually even have students looking at hepatitis A epidemic currently that we're experiencing, as well as mental health and substance use disorder as well. So we do have a variety of different students from the chronic conditions like diabetes and heart disease and promotion of, very kind of chronic disease prevention. And then we have students from mental health and substance use, breast cancer, maternal mortality, sort of across the board, environmental health issues like lead, even students working with community organizations. Throughout, we've had students working with individuals who are in refugee status in this country, as well as immigrant status in this country, and trying to help them navigate and understand the healthcare system and understand better their needs and their health, specifically their health needs and the needs of their families, and how the systems that we have, contribute to that. So we have a variety of different topics.
In the past, people wouldn't talk about breast cancer, and now we're much better as a society talking about breast cancer. But what's sort of the most difficult public health issue that we don't talk about that we should talk about? There's probably a few.
A lot, yes. Well, and sometimes it's hard because it's funny. Sometimes I talk with people and they're like, "Yes, we don't talk about this," or "People need to talk about this as a public health issue," and I'm like, "What do you mean? We talk about this all the time." But I forget in my world of with our public health community, we sometimes what we talk about or what we feel like people talk about all the time doesn't necessarily. Really reflect what many people do discuss all the time. So I think we have an incarceration epidemic in this country that's, within the public health world, we do talk a lot about the criminal justice system, the inequities thereof, and the incarceration epidemic, but that has a huge impact on our community's health when you have individuals cycling in and out of prisons, when you have lots of mistrust, when you have the degradation of communities without the reinvestment, gentrification, which, all these things, again, we tend to see them as individual topics like, education and employment is completely different from incarceration, but they're not, right? Yeah. They're all really connected into how we invest in communities and how we provide the supports that communities need. And that is intimately connected to the incarceration epidemic, is connected to the educational inequalities that we are experiencing. It's connected to the mental health and the experiences of trauma that individuals are experiencing. And so I think the more that we can see these things as connected, then it will be harder for us to kind of forget or to think like, oh, that doesn't apply to me or that doesn't apply to the issues that I'm interested in, but to really see them as multifaceted.
That whole picture.
Absolutely.
When you said that, it reminded me, last night I saw a clip of Brian Stevenson, and because today the movie is released everywhere,
awesome.
Just Mercy.
Just Mercy.
And
awesome.
And he's just been such an awesome person in the work that he has taken on. But when you mentioned incarceration, and it triggered that, him talking about that the incarceration is one piece, and then he has spent his life dealing with death row inmates, and those, I think it's 134 individuals that he's gotten off of death row because they were not guilty, and so that's pretty scary in light of there was a statement made that the federal government was going to, I guess there had been a little more moratorium for a little while, but they're going to reinstitute the death penalty. So when I saw that, just kind of felt horror, and knowing that has to be something that's clearly tackled again, you know,
Absolutely.
and to
Absolutely.
literally, you know, because what his comment was, and even for those who are guilty, you know, he starts talking about the inequities
Yes.
of trials and the
Absolutely.
criminal justice
Yes.
system, and so the
Yes.
fact of the matter is that, um, you know, from his perspective, of the fact that the death penalty still doesn't have to exist, even for those who are guilty, you know. And then we know people will have obviously different perspective on that, depending
Yeah.
upon if it was their loved one
Of
or their
course.
whatever,
Of course.
you know.
Of course.
You know, you're going to feel
Of
like,
course.
you know, give them death, you know, to kill you know. But what about those who are not guilty?
Right.
And literally, you know, so
Absolutely.
they end up in the situation, and
Right.
then so we don't even know how many have
Absolutely.
actually died,
Absolutely.
you know, as a result of that. There were innocent people, and
Absolutely.
so how do you do something where you err to the, you know,
Absolutely.
rather than if the person is guilty, then they're in jail and they can't get out, versus erring to kill someone who was innocent all along. You know?
Absolutely. I
'Cause
mean,
once they're dead, they're
Right.
dead. You know, you can't
Absolutely.
do anything to get their life back.
Absolutely. I mean, there are so many inequities in the incarceration or the criminal justice system, as you have articulated. And many people, because many individuals cycle in and out of the system. I think one of the biggest things is if we began to change the framework within our systems, and many criminal justice advocates have researched, you know, to support this, that if we really change our framework from a punitive one to a rehabilitative model, then we would be more successful, because even many individuals who, you know, may be quote unquote guilty of the crime that they committed have been in and out several times for lesser crimes, and to most individuals incarcerated are incarcerated for nonviolent offenses, right? And so if we had a better system to kind of see, okay, these are people who are falling through the gaps that we as a society have created in the majority of situations. And so if we can begin to identify those things earlier and have a system that really supports them, and there is evidence and there's research that shows the types of programs that are effective, but we have not been, you know, systematically investing in those programs so that we can catch individuals. There are great success stories of individuals who have been incarcerated and exposed to something that has changed their lives. And so what if that story was the norm? That what if the incarceration system was a safety net, almost a catchment initially for individuals who have experienced trauma, who have fallen through some cracks, who haven't had the supports or the foundation or the mentorship or the role models or the opportunities that many individuals have had, and was able to expose them to things that they're interested in and could see a viable life supporting themselves in. You know, what if that story wasn't just the one story of this person made it out and this person made it out and had this life-changing situation from a path that they clearly were on that was destructive, but now they are doing amazing, amazing things. You know, what if that was the norm? But we would have to change our framework. We would have to, you know, think about prisons and our whole mechanism of how we incarcerate people. And really, what if our system was more evidence-based? Because, you know, our criminal justice advocates would say there is a lot of evidence out there as far as what types of approaches and programs work, but we're not necessarily systematically implementing them in meaningful ways.
I think it's good that you're mentioning that the Just Mercy movie
Yes.
is coming out
Yes.
today. I think that will educate a lot of people, and I think generally we learn well from stories. So I think that film, the book is certainly very
Yes.
readable,
Awesome.
Yes.
but a film that's
To
really
that,
great. So Just Mercy, and then there was a program on public television about prisons in upstate New York. It was produced by Leon Botstein, the president of Bard College's daughter. I'm pretty sure her name is Sarah.
Okay.
And it was about how the prisons are in these isolated places in upstate New York. So then how does a family manage to
Yeah.
visit
Yep.
their loved one who's incarcerated?
Absolutely.
And probably, I think there were private prisons too.
Yes.
So we have less control because
Yes.
it's not part of our government
Yep.
to have that oversight.
Absolutely.
So that's another program where you can learn that some of the inmates, and these were the stories that she was capturing in the program, graduated from college because they were able to have classes while they're in prison, and learned and graduated from college. And one of the examples in one of the interviews, this person became a lawyer. He became a lawyer.
Awesome.
Great.
So, but why does someone have to go to prison
Exactly.
to realize
Right.
their talents
Right.
and get
Exactly.
education
Yep. Absolutely.
and see themselves as
Absolutely.
now a useful, well-educated member of
Absolutely.
society?
Absolutely.
So are there other stories that you think would be beneficial just on that one public health issue of mass incarceration?
Absolutely. I mean, there's so many individuals who have that similar story. There's, some great individuals who have, like you said, books and movies and programs who are trying to give back and, spread their message through their own personal story, which is fantastic because they live the life and they can speak more authentically to kind of their own transformation. But I think you raised the ultimate point of why do we have to wait there? It's one thing to say, okay, we need to make this system more supportive so that this can be at least a place where people can make that turnaround.
Yeah.
But at the end of the day, right, we already know also through lots of research and through the ACEs, the Adverse Childhood Experiences study, that children who grow up in certain environments with certain stressors and certain things that happen to them.
And lack of resources.
And the lack of
for them.
resources, that they are highly vulnerable to participation in activities that will, have a higher risk of leading them in jail. And so we know almost the whole lifespan, right, as far as risk. And, there is growing research or growing interventions, but we have not committed to intervening even in the areas that we know. We know children and communities that have high exposure to these things are going to be vulnerable to participation in lots of activities. But we haven't invested in them. We haven't invested in interventions that are successful, and even doing the research to understand better what those interventions need to look like and how can we integrate them throughout the school system or the community.
So as our time is winding up,
Yes.
This is a great conversation, but I do want we will end up on a little lighter note.
Yes.
And to have you talk just for a moment about your book and promote that, and
Sure.
we'll end on that note.
Awesome. Well, thank you again for having me here today. I just recently published Reflections of Me, which is a children's book, actually, based on research that I did primarily with women of color, African-American women. But the book was really inspired by them and the messages and stories that they shared, really about all the experiences of discrimination that they have had throughout their course of their life, and really messages they wish they would have heard as a child. And so really as kind of to just reflect the messages and the things that they shared with me, I wanted to do something, create something to embody what they wish they would have heard as a child, and to really promote a strong sense of self-worth and self-concept, so that they could just know how valuable they are. And as we talked about the disparities, that children can just know that they are loved and that they are valuable and that they are gifted, and they have a lot to contribute to our society.
And that's starting right at the beginning.
Yeah.
Absolutely.
Right.
Time to start. Prevention.
Right.
Absolutely.
So we thank you for being here, and clearly we're going to have you back again.
Yeah.
It's a conversation that we can certainly continue to have. And so to our audience, we hope that you received a lot of good information. And in 2020, let's all consider what steps we can take to not only have our say, but to impact society as a whole. Thank you.